Addiction affects Hollywood's elite as much as people on Skid Row and negatively impacts every aspect of life. Dr. Starner Jones is a board-certified emergency and addiction medicine physician and founder of Nashville Addiction Recovery. He is a graduate of the Addiction Medicine Fellowship at Vanderbilt University Medical Center. Dr. Jones has treated over 80,000 patients and detoxed more than 1,000 people during his career.
Nashville Addiction Recovery is different from other treatment programs in 3 ways. First, we detox patients in the location of their choice, including homes, luxury hotel suites, or in our office. Second, we treat addiction as a disease rather than a moral failing. And third, we teach patients to be dogmatic about sobriety and wear it like a badge of honor.
I have 8 years active duty as a medic, and then I have 30 more years with the Nashville Fire Department as a medic. So between he and I, we've kind of seen it all, done it all. Nothing catches us off guard. In most inpatient facilities, the first thing that you have to surrender when you arrive is your phone. 94% of all those patients will relapse within 1 year. The reason we don't do that is that's not real life. If you cannot learn to function in your own environment, we're setting you up for failure.
The longer a person is active in a relapse prevention program, the more likely they are to maintain sobriety. So a person who participates in a 90-day program is more likely to stay sober than someone who participates in a 30 or a 60-day program.
They come in at a time when you're so vulnerable and sick and in desperate need of help. Just the fact that they come to you is a huge benefit. And a lot of people can't go outside their home to get help, and they don't have that option, or they have young kids or careers. And it's a unique program in that they're able to deliver what you could get in a hospital, but they bring it to your home.
People often ask how I became interested in addiction medicine. I met my father when I was 28 years old. He was living in a shack in Mississippi that did not have running water or electricity. He had lost everything because of alcohol addiction and was huddled next to a propane heater to stay warm. My father had 11 DUIs in 7 years. The chief of police in his hometown called one day and said, "Your father's not doing well. He needs to be admitted to a hospital." My father was admitted to a hospital, detoxed by a doctor who saved his life, and he never used alcohol again. He lived the last 12 years of his life sober. We had a wonderful relationship. He was kind, loving, and benevolent with what little he had. But my dad had a saying. He said, "Alcohol will take everything you have and then it will kill you." And when addiction is not treated, that is absolutely true.
New research in genetics has uncovered a link between DNA sequences that code for dopamine receptors and predisposition to alcohol use disorder, as well as other substance abuse disorders.
Genetics plays an important role in addiction. The A1 allele is a DNA sequence located on the short arm of chromosome 11. It codes for the dopamine receptor gene and has been associated with predisposition to alcohol use disorder and other substance use disorders. People born with the A1 allele have a lower density of dopamine receptors. This affects reward pathways and increases susceptibility to addictive behaviors. Dopamine is a neurotransmitter that plays an important role in movement, memory, pleasurable reward, and motivation. Many drugs of abuse cause dopamine to flood the brain's reward pathway and induce euphoria.
Most recovery programs don't work. Nashville Addiction Recovery is a lot different. They don't take away my cell phone. They don't put me in a room with a bunch of kids and say, "Now talk about your problems." They offer personalized one-on-one care, relapse prevention that really does work. I've learned how to manage my triggers by being proactive about my sobriety. Dr. Jones and Thomas have taught me to manage my triggers, and the best way to maintain my sobriety is honestly to be proud of it.
We're not a cookie cutter facility. You come to us, what I do for you may be totally different than what I do for somebody else, but it works. You do have to wear it like a badge of honor. Let people know, "No, thank you, I don't drink." Somebody's gonna come into your life that says, "Hey, Thomas, I notice you don't drink. Why?" And that's gonna be your opportunity to change their life, because you've been down that road and you understand it.
Corporate medicine tends to treat patients with addiction as a nuisance. We're different. We don't judge people. We treat them with respect and approach addiction as a disease, not a moral failing.
Nashville Addiction Recovery is a luxury detox and aftercare program that treats substance use as a disease rather than a moral failing.
Nashville Addiction Recovery changed my life because they came in at a time when I needed them the most. I couldn't leave my home and my kids and my job. I feel like they rescued me. They came in, and these infusions are a game changer. They help so much with the uncomfortable side effects of detox and withdrawal. And it was just an amazing experience that I'll never forget.
These guys have saved my life, and I don't ever want to use again.
We see our program as the preferred option for people who want to be sober.
When you are addicted to alcohol, you run into a situation where you have one drink is too many and 13 is never enough. And so what ends up happening is you end up poisoning yourself again. You have to treat the alcohol as if it's something you're allergic to. If you address it from that angle and begin to see it as poison in your body, you won't drink poison. Most people won't.
If you're listening to this and you're struggling, let me assure you, you are not alone. There are millions of people across the country struggling with addiction. There is hope at Nashville Addiction Recovery.
For more information, visit NashvilleAddictionRecovery.com.